So, like I had mentioned, we were concerned. Obviously, brain surgery is a big deal. Um, we weren't sure which route we were going to take, but ultimately, the neurologist's office and like the team that they work with all decided that Leo would be a good candidate for the hemispherotomy. Um, and then they gave us a few names of different surgeons, and we chose Dr. Tomich. And he explained to us, what it would look like and what would happen, and um, more like best case scenario. Um, and unfortunately, Leo kind of had more like the worst case scenario, but it was still worth everything because his quality of life is so much better now. Um, so it took a few months to kind of get the ball rolling and get everything scheduled and figured out between, my work and my husband's work. But thankfully, we were able to make all of that work. And Leo was in the hospital for about 4 weeks due to some complications with fever and just weakness and all of that. Then he went to rehab for about 4 weeks after that. So all in all, it was about 2 months of recovery, and he started back at school. Uh, like half days for the first week, and I just wanted to kind of go slow, but he did really well. Um, he did not have any seizures for the first, let's see, September, October, November, 4 months. He was still on all of his meds, but we were slowly tapering off. We started with one in particular. That was the last one that we had added. And as soon as we took him off of that, he did have seizures. However, we didn't really feel like the that medication was really helping him that much, so we decided to take him off of that one completely and increase one of the other ones. And as time has gone by, um, he has had some seizures. He's had some clusters, I would say. Uh, he'll go like weeks without anything, and then all of a sudden he'll have like four in a day. So anytime this happened, I would be in touch with the neurologist, and we would kind of change some of his medications or increase dosing. But also, I would reach out to Dr. Tomich by text, and he would always get back to me, and just talking about options and all of that. Um, all of the different, there was another surgery, but something down the line. But we were just kind of keeping a really close eye on the seizures and the activity. And then I don't know what changed, but he went, so he hasn't now, knock on wood, hasn't had a seizure that we're aware of that we can see um, since December of 2022. And it's now March of 2024. So we are thrilled with that. He is continuing his medication regimen, um, but at some point, the doctor, the neurologist that he sees now, we will be probably starting to try to taper off one of them. Maybe in like 6 months or so, we had decided maybe we would try to start. Um, but overall, it's been a great experience. Just looking at what other questions. Um, all right, I'm going to pause here.